I'm Jim Krause, and I am the Scientific Director of the Spinal Cord Injury Research Fund and an Associate Dean for Research within the College of Health Professions. And I'm going to talk to you a little bit today about some of our research. And our research is primarily focused on neurologic injury, specifically spinal cord injury, but also traumatic brain injury. Unlike a lot of what you'll see today with laboratories that look at specific aspects of function and try to help something such as gait or upper extremity function, we look at the individual as a whole. We look at their environment, all the circumstances, and we really try to look at all the factors that might relate to their outcomes. And we do this using a theoretical risk model, which I'm going to go through very briefly and give you an example of how we use this to look at outcomes that people have, factors that relate to those outcomes, and then also how we have done research on mortality and spinal cord injury. So we follow individuals all the way through from the time of their injury, really up until promoting greater longevity in our study groups. So if you look, this is the beginning of our model. Basically, you have individuals with neurologic injuries. They have certain characteristics biographically, and they have certain injury characteristics. At some point, everybody dies. And so one of the areas of research is to link people's biographic characteristics and also their injury characteristics to their longevity. But our goal is to promote longevity. So we also look at several intervening sets of factors. And the first are health factors. So obviously, before someone dies, there are root causes of health complications that lead to mortality. And if you can identify those things that lead to mortality, then that's the first step to preventing it. We look at health behaviors because changes in health do not occur in a vacuum. They occur for reasons. And the primary reason for differentiation of health, or at least one of the primary reasons, is that people do different things that are either healthy or unhealthy, which changes their health and which changes their risk or vulnerability of early mortality. We look at two additional types of factors, psychological and social environmental factors. And these factors also will influence health and longevity. And they do so by psychological factors influence the types of behaviors that people have. And if you can identify at a psychological level, at a personality level, then you can help to prevent those behaviors that might in turn lead to diminished health. Similarly, social environmental factors are very important. Things like social support, also income, access to care. There are dramatic differences in the population with how much people have access to care. Those that have better access to care, they're certainly going to be healthier and live longer. We acknowledge that with this arrow that whereas we expect that psychological and environmental factors are going to influence behaviors, which influence health, we also know that social environmental factors will influence health directly. And we also know that certain types of behaviors can directly lead to mortality. So not all mortality is preceded by a lengthy decline in health. And the last thing I want to show you is the application of our model with real research. And this pulls together a lot of areas of what we do. On one of our studies, we looked at which health factors are most likely to lead to diminished longevity. And when you look, you can see that hospitalizations, people that tended to be hospitalized, things were happening to them, had a greater risk of mortality. And then a number of secondary health conditions, amputations, a history of pressure ulcers and pressure ulcer surgeries, a history of depression, and then infections also increase risk. We looked at risk behaviors, and as you can see, again from the diagram, you can see that there are several types of behaviors that led to an increase or decreased risk of mortality. And the things that led to an increased risk were overuse of psychotropic medications for pain, spasticity, sleep, and depression. So people are getting those prescriptions because they have problems, but also the medications in of themselves. If someone takes too many medications, it leads to an increased risk. Tobacco use was very strongly related to mortality, and not necessarily through traditional causes like cancer, but after a spinal cord injury where some people have diminished function, then also tobacco use, the risks are heightened for shortened longevity. We also looked at things like hours out of bed was a primary factor that helped people to survive longer, the more active they were. And then lastly, binge drinking, 5 or more drinks on occasion. People doing risky types of drinking patterns were also associated with early mortality. We conducted 2 other analyses where we looked at the environmental and psychological factors, and the 2 things that we identified from a psychological perspective that were related to risk of mortality is, one was sensation seeking. People that have injuries often have them to begin with because they're doing things that maybe they shouldn't be doing, and that was one of the risk factors. On the other hand, people that find purpose in life, something that drives their life, they continue to be engaged with life, they will likely live longer. And then from the perspective of social environmental factors, having social support promotes greater longevity, but for people that have poverty and inability to pay for services, their survival is very compromised. And then lastly, we did one study where we looked at all factors simultaneously, and you can see the ones that are most important. And this again is an example of pulling everything together so that we're identifying what are the factors that lead to changes in health, how does that relate to longevity, then what are the characteristics of the individual, the environment, what are their behaviors, and how can we intervene to help people live longer? How can we intervene to help people live healthier, to do things to be more active, to work, to engage in their communities and with their families? And that really reflects the extent of our research. We look at the person as a whole, and we take them from the time of injury all the way through their life cycle. Thank you very much.